Professor of Bioethics and the Director of the Division of Medical Ethics at the New York University Langone Medical Center's Department of Population Health. He writes a regular column on bioethics for NBC.com and is a monthly commentator on bioethics and healthcare issues for WebMD/Medscape. And he has an article at time.com, Is Ordering Takeout Unethical? A medical ethicist answers some of the most common moral questions around coronavirus. Welcome to Background Briefing, Arthur Caplan.
Thanks for having me.
Well, thanks for joining us, Arthur. And let's go through some of the questions that people have in terms of the ethics of protecting oneself, one's family, but also the population in general. You know, just today I went to the market, the local supermarket, and we had to line up because the place was restocking. So we're lining up outside, and I held a place for a woman, and she came back into the place, and the man behind her got into an argument about her getting in the line. And I thought, let's not go down this path. I mean, I read an article saying that a lot of Americans who aren't necessarily, NRA types are starting to buy guns. I mean, do we need to get into a situation where people are shooting each other over a can of tuna?
No, we don't. There are some glitches because of panic buying. So some items, the proverbial toilet paper and paper towels, bread are missing from the shelves, but this is not a situation like a flood where the roads are blocked and people can't resupply. Food is here, supplies are here. The grocery stores will get restocked. We don't have to push each other out of line to get a shot at the English muffins. They'll be there. If they're not there today, they'll be there next week. And there's plenty of other food around, and nothing is interfering from the virus with the food chain. Maybe we lose some workers. Maybe it's a little slower, but it'll run, and no one's proposing to stop it, and nor should they. In terms of social order disintegrating, that's panic, that's anxiety, that's way over-responding. All we've asked people to do now is stay at home, do the isolation, do the social distancing. It's not that the police and the National Guard are going to fall apart, even if we had to continue this quarantine and people started to leak out. I think we'll be relatively gentle in the reinforcement. But this is not a disaster nuclear war scenario where you have to hole up in your bomb shelter with a shotgun waiting to defend it against people looking for resources. That's just out of control.
Well, in terms of this being a case where older people older than 60 years old are more vulnerable, is there a protocol here that could be followed? I'm wondering about, for example, we know out here in California, one of the early cases, she wasn't able to get tested, and a whole bunch of nurses and doctors had to go into quarantine. The very people you need are in quarantine. The same thing's happening near you in Connecticut. 100 nurses are in quarantine because they couldn't test somebody that came in with the coronavirus. Would there be a way to focus on isolating older people as opposed to young people? Is that practical? In other words, are we just throwing resources at everybody as opposed to protecting the most vulnerable?
Well, it's a good question. I think the answer right now is the virus is spreading too fast, and there are too many old people mixed in with young people. So it's not that the old people are all at nursing homes. If they were, we probably could isolate them and let everybody else wander around, get infected, build up some immunity. But they're scattered all over the place. They live with younger people. They're taking care of the kids. When people are home, they are too at risk to, right now, put everybody out on the street and let them take their chances if they're under 65. Britain tried that policy initially, by the way. That's what they were doing up until a few days ago. Then they realized there are just too many vulnerable elderly out in the community, and they're going to kill them if they do it that way. So you can see Boris Johnson, the prime minister there, and government beginning to back away from that idea. However, it's interesting, Ian, it's not a bad question to ask about 60 days from now. Let's say we've got the virus tuned down, and it's not moving as fast, and we said to younger people, okay, now you can go out, and will accept a certain risk level for older people, but because the epidemic or the pandemic isn't quite as bad, we'll do a trade-off of movement ending social isolation for a slight increase in deaths among the elderly. And that sounds callous and that sounds hard-hearted, but I think it's a choice we are going to face down the road.
And again, I'm speaking with Arthur Caplan, who's a professor of bioethics and the director of the Division of Medical Ethics at the New York University Langone Medical Center's Department of Population Health. He writes a regular column on bioethics for NBC.com and is a monthly commentator on bioethics and healthcare issues for WebMD/Medscape. And he has an article at time.com, Is Ordering Takeout Unethical? A Medical Ethicist Answers Some of the Most Common Moral Questions Around Coronavirus. So let's start going through some of the questions here. The first one I would ask you, Arthur, is it safe to have sex with your spouse or your partner?
I would be abstinent right now. Interesting enough, I saw the esteemed Dr. Oz on TV saying, have a lot of sex, it breaks anxiety and the psychological consequences of being isolated. But look, some of us have partners that we just met, and so they could have been exposed, and even though we're newlyweds, I would be cautious there. Some of us are going to work anyway. They're hospital administrators, they're nurses, they're emergency room people, they're policemen, they're firemen, they're working in the restaurants, even if they're just doing delivery. You have to be cautious. This thing can spread by kissing, by intimacy, as well as by sneezing and coughing and spitting, which you don't want to do either. So I'm going to say, no, let's do the 14-day abstinence period. Then if no one gets sick, everybody back at it.
All right, let's move on to the question in the heading of your article at time.com, Is Ordering Takeout Unethical? In other words, what you're saying here is if you're shut in and you order takeout, the person who delivers it is sort of the sacrificial lamb. Is that what you're getting at?
Exactly. So I think the thing to do here is follow some rules about infectivity. Have the person leave the food at your door. Don't open the door when they're there. Let them go back to their car. Then minimize, in other words, contact between you and them, both airborne and touching. Make sure that you don't use paper money. That carries viruses and things when it touches you. If you can do it, all credit card. That's better for the delivery person, better for you. I would put my paper money away generally and try, if you can, to go all credit and those PayPal system type things and so on. I think the other thing to do is to order some food for delivery. Even if you get some food at home, you don't want your local restaurants collapsing. They're trying to stay afloat by delivery, so use it a bit. Ironically, it's not only unethical, it might be ethical to use some delivery when you might have a choice, just because you don't want those businesses to go under.
And how do you navigate shopping? As I mentioned earlier, I went to the market this morning and I kept thinking about social distancing and people, the shelves are half empty. So people are grabbing stuff. You're right next to, you're looking at something, the next thing somebody pounces over your shoulder and grabs it in case you're going to get it. So again, what are the ethics of interacting in public as limited as it may be?
Yeah. Well, don't go shopping without your hand sanitizer. I haven't seen enough of that out there still. Those wagons and bags get touched and get contagious, so do the shelves and the surfaces. So use it a lot when you're out there. Try to maintain distance. If you're in a line, ask people to back up, maybe do the 6-foot thing. I'm not sure it's hugely effective standing indoors and outdoors, but it couldn't hurt, so let's do that. And ask the store manager to put some restrictions on what amounts people can buy. If they're trying to buy all the bread in the store, I think the store can say, it's due to a customer. They do it in other circumstances. They should be doing it here as well. Imposing limits on how much you can take of something, I think, is a great idea, and I wish grocery stores would do it. And I've got one other idea. The elderly are vulnerable, but the elderly need food. I wish every grocery store and pharmacy would say the first 2 hours every day are for elderly only or at-risk people if you're getting cancer treatment or have an immune disease, and then everybody else can come. Let's let them go and minimize their risk.
Well, what about when you bring the food home, though? If you just said that some of it could be contaminated from the shelves and from packaging and people touching it, etc., does that mean you have to sanitize your groceries before you take them into the house?
No, I meant sanitize your hands when you're in the grocery store. I'm not quite as worried about bringing things home, although I might open up whatever it is, say something that's got a plastic cover on it or saran wrap, that kind of thing, a meat or a chicken, poultry, something, fish, and then wash my hands before I started cooking it. You can't wash your hands too much at a time at which the virus is hanging around on all these surfaces and places. So this is the time to be an obsessive nut and just do it, but it doesn't mean you have to wash off the packaging. It just means once you touch it, open it, go after it, then wash your hands again. It's the same thing I would tell you to do anyway if you were dealing with fresh fruit and lettuce when we have those worries about hepatitis.
So is there anything to this notion that sunlight kills viruses and that refrigeration has the opposite effect, that they become dormant and they can be reactivated? In other words, is there anything that one can do to limit the virus just in terms of either sunlight, heat, cold? Because I've been getting some conflicting information about this, and my understanding is
I'm going to say no. I'm going to say the simple answer is no. You can cook food. You might, want to avoid eating things cold because cooking definitely does get rid of viruses. So if I had my choice, you might prefer soup over potato salad or something like that. But generally speaking, no, the viruses don't care if they're in the refrigerator, and they don't much care if they're out on the counter in the sunshine. Somebody, I think President Trump suggested they don't like warm weather. There seem to be plenty of cases in Florida and Italy and places that are warm right now. So, no, I think the viruses have adapted to our world, and they don't really adjust to the kind of temperatures that we're talking about.
So in terms of medical ethics, my daughter is an emergency physician. She runs an EMS department. She's a medical director at a major hospital back east. And well, you are.
That's great. Good for her.
And I worry about her. She's going back to work in a couple of weeks. She's been on pregnancy leave. I have a new grandson, which is wonderful. But I worry about her. I worry about her in terms of what kind of protections do people have. I mentioned earlier the case up in Connecticut where 100 nurses who vitally needed are all in quarantine, and that's a result of the incredibly poor handling by this government in terms of the testing kits. So what would your advice
Well,
to
first
me
I'd say don't worry too much. Don't worry too much about your 34-year-old daughter. Even if she gets sick, she's going to come through it. The odds are overwhelming that she will survive. The death rates, if you're 85 and older, are 20%. The death rates, if you're between 20 and 40, I think, are 0.01% or less. So I wouldn't, it's not going to be fun. It'd be like getting a bad case of the flu, but she'll be there. She'll be